Introducing Labour's plans to tackle NHS wait times, Keir Starmer said when elected, we'll be responsible for dealing with nearly 8 million on the waiting list. It's never been that high, with Wes Streeting, Shadow Health Secretary, claiming if the Tories stay in power, we'll see NHS waiting lists as high as 10 million. Well, Starmer's certainly right about the first claim. Under the Conservatives, the waiting list has exceeded previous records, now standing at 7.5 million cases, equivalent to about 6.3 million people. But the claim the waitlist could hit 10 million if Rishi Sunak stays in power is pretty dodgy. Labour have drawn a straight line through the highest waiting list growth rate under Mr Sunak's premiership and extended that trend onwards. But this ignores the fact numbers have now started to fall and the impact of addressing existing plans to reduce wait times. But that to one side, Labour's key pledge is that by the end of the first term of a Labour government, we can restore NHS waiting time standards to 18 weeks. Well, here's that 18-week target for an appointment for treatment, and it's not one that's been met since 2015. To be fair to the Tories, they were dealing with the fallout from the pandemic, but waits were still rising for a long time. So how will Labour restore this? Well, according to Keir Starmer, one of the first things we do is have 40,000 extra appointments every week. Labour says they'll do that by having more appointments on evenings and weekends and buying more equipment like scanners. But the challenge is one appointment doesn't necessarily clear one case from the waiting list. So Labour's 40,000 extra equates to this bar in red. That doesn't go a huge way to closing this gap between the number of people joining the waiting list and those leaving it. The fact the NHS is recruiting more hospital doctors and nurses will help, but to deliver 40,000 extra appointments, Labour will have to persuade those staff to work less social hours and pay them accordingly. Given ongoing pay disputes and burnout amongst NHS staff, that's easier said than done. But Starmer sounds confident, saying the last Labour government said it would get wait lists down and did it. But the last Labour government had less of a backlog to clear and also took a decade to do it, not a single parliament. So Keir's pledge to hit the 18-week wait time target might be achievable, but it relies heavily on the goodwill of those working in the NHS to deliver on it.